Okay, welcome everyone. I'm going to get started as looks like we have a lot of folks on time today. Thank you. Looks like the 9 o'clock start time might be better for everyone than the 8:30. So happy to see you all this morning. I'm April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative, and this is our first quarterly meeting of 2026. So thank you for joining us. If you haven't already, please do a quick introduction in the chat, just who you are and where you're coming from. We are recording today, and I will include the recording and the slides on our website in the next couple of days. So if you have to drop early, don't worry about it. For anyone who's new to the Chicagoland Healthcare Workforce Collaborative, we exist to unite employers and industry partners to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develop responses to the evolving needs of our industry and workforce. We focus on breaking down barriers so more people can enter the healthcare workforce. We focus on strengthening the relationship between our employers and our training providers so that we can innovate in the way that we are training people and building pipelines. And we also talk a lot about how to make sure we are offering accessible opportunities for people to advance above those frontline positions and move into wealth building wage roles. We are an employer-led collaborative, so it's the health and hospital systems in Chicagoland that are leading the way, sitting on our steering committee and deciding what we pursue. We have over a dozen healthcare systems at the table, but we are also supported by more than 20 strategic partners who are just as important to this work. That includes our community colleges and training providers, our workforce development organizations, advocates, funders, and others. So anyone who is invested in creating a stronger, more inclusive healthcare workforce in Chicago is welcome to join these meetings and most of our events. Today, I will present our plans for the year and do a quick run through of our 2026 strategic plan. I will also invite Matt McClintock here to give some updates on the plans this year from the Youth Pathways Committee. Thanks for being here, Matt. Then we jump into several partner presentations. We're lucky to partner with Burning Glass Institute on an event in January. They provided a data overview of the healthcare workforce in Chicago. So we'll see some slides from that presentation today, a mini presentation and a little debrief from that event from Cecilia Joy Perez and Joel Simon from Burning Glass Institute. And then we have Jordan Powell, excuse me, Jordan from Illinois Health and Hospital Association, who will provide some updates from the Illinois State Legislature on policy, things that have changed and policy priorities out of IHA. Then we have the team from OAI, Zaufan and Yvette. OAI has just received Department of Labor approval for a registered nurse, registered apprenticeship in the region. So you'll hear about that and your opportunities to partner on that project. And finally, Anna Yankelev from Health and Medicine Policy Research Group, who also facilitates our sister table, the Public Health Workforce Collaborative, will present a career pathways resource that they have just been finishing up out of health and medicine. So we have a packed agenda of presentations today. It will be a little less discussion based this quarterly meeting. Our next two quarterly meetings are in person and will be a lot more discussion based and have a lot more networking time. But please feel free to put your questions in the chat at any time and come off mute, raise your hand. And finally, at the very end of the meeting, we will save some time for community announcements. So if you have something that you want to share with the group, an event, an opportunity to partner, you're welcome to share at that time. So I'm going to dive into CHWC's plans for this year, and I will drop in the chat a link to our 2026 strategic plan. It is just a 4-page document, so it's not a lengthy document. It's we iterate on this every year. It comes from feedback from all of you through surveys, through some polls that we did at last year's December quarterly meeting, and through more focused discussion with our steering committee. So what you see on the screen right now is a vision statement that our steering committee drafted back in 2024, maybe late 2023, to describe where they wanted CHWC to, what they want CHWC to look like by 2029, which is that we are a healthcare workforce development think tank led by exceptional healthcare leaders, and that we are recognized as a exemplary model of peer learning and collaborative problem solving. So peer learning and collaborative problem solving is our bread and butter, what we really try and focus on. Our steering committee will convene at a mid-year retreat to revisit this vision statement, see if we want to update a little bit, and explore the possibility of adopting some measurable long-term goals that we can use as a North Star. So as I said, facilitating peer learning, fostering connections between all of you and helping you build partnerships is the main goal of CHWC. We do that by hosting several learning events. So we will host at least 6 learning events this year. We've already hosted 2, and we have another one next week. Some of the topics that we'll tackle this year that were surfaced at the December quarterly meeting and also through the steering committee are one will be about employer and community college partnerships, what makes those work really well. Another will be similar, but with employer and workforce development organization partnerships. We will have an event around transportation barriers that are faced by your employees and your workforce development program participants, with some time for collective brainstorming on solutions to those barriers. And we will also have a full collaborative event on fair chance hiring. That means opening the doors for individuals who have prior justice involvement and may have arrests or convictions on their records. We will dedicate our June quarterly meeting, which is on June 2nd in person at Malcolm X Community College, to unpacking the federal funding changes, federal policy changes, and how those impact the healthcare workforce in Chicago specifically. I have been reaching out to folks and trying to put together an agenda for this. I am still very open to suggestions. So if you know anyone who might be a good presenter, or you have some ideas around conversations we need to have in this topic, please feel free to reach out. Then we will also explore the possibility of hosting a radiology or imaging workforce summit. As many of you know, we hosted a respiratory therapy workforce summit last year. So we are trying to replicate the success that we had with that in the radiology imaging space. A large event like that might not happen this year. It might get pushed into 2027, just based on capacity. But I am currently trying to understand this workforce space at the moment. So if you are involved in training the radiology workforce, feel free to reach out to me. Finally, we will also host an in-person employer peer learning event. That's been a very popular event the last couple of years. And I also want to make myself available to facilitate mini peer learning sessions. If your hospital system is starting a new program or facing a similar challenge as other health systems, and you would like me to provide a space for you to unpack that together, please feel free to reach out anytime. I'm open always to those suggestions. I'm not going to go fully into the priorities on the side there. They're in the document, but we want to remain data informed, like working with Burning Glass Institute, want to continue to increase our reach and reputation as a table. Whenever possible, we would like to leverage our collective voice if there are any policy opportunities to do that, and always will support efforts to fund workforce projects. Speaking of learning events, we do have one coming up next week, and I will drop more info and registration in the chat. This this event highlights the partnership between Northwestern Medicine and an organization called CLASP. CLASP has piloted a new model for recruiting that helps health systems create relationships earlier on with students who are pursuing healthcare roles that are hard to fill for hospitals. So Northwestern is able to um, access talent, recruits for some hard to fill roles, and those students are able to secure student loan repayment partners before they even graduate. So I encourage you to join us for that virtual learning event next Thursday. And last slide about our strategic plan. And apologies, I'm seeing the typo. This is for the 2026 strategic plan, not 2025. A big thing that we are focused on is carrying out all the work that we planned at the Respiratory Therapy Workforce Summit last November. So at that day-long summit, we identified 7 strategies to pursue as an ecosystem to increase the number of respiratory therapists in our region. We have 5 working groups that have now been launched to carry those out. Those are led by co-chairs. We have a steering committee that helped me plan the event. So I am focused on making sure that all of that work continues to happen. And I am dropping in the chat a link to the action plan for that respiratory therapy collaborative if you are interested in learning more. Again, feel free to reach out to me if you aren't engaged in that and would like to be. And then I'm not going to spend too much time on the other projects on the side. The Advancing Equities Career Pathways grant we talked about at our last quarterly meeting. That is in partnership with Malcolm X College, supporting students, primarily Black men. The second box there, I haven't talked a lot about in full meetings, but will soon. It's a project in partnership with CARA Collaborative and Corporate Coalition and the Chicagoland Workforce Funder Alliance to create some new resources to help justice impacted individuals navigate their opportunities to work in healthcare in Illinois. We will talk about the Career Pathways resource later in this meeting. And finally, there is a nursing pathway that is being explored, being built at Malcolm X College, and we are supporting that. That is an ongoing project that has seen some delays, but is still moving. So before I pass it off to Matt to share some updates on what the Youth Pathways Committee is up to this year, does anyone have questions about our plans? And I know that it's a lot of information. So if you're new, if you haven't you heard about a project that you're interested in learning more about, please feel free to contact me. Okay, with that, I'm going to invite Matt McClintock to let us know what the Youth Pathways Committee is up to this year. This is a committee that launched in CHWC several years ago and now has grown to take on a whole scope of its own under the leadership of Matt. So, Matt, take it away.
Absolutely. Thank you, April. Yeah, for those that may be unfamiliar, the Youth Pathways Committee is a sister table to the CHWC. It does have similar focus areas in that collective problem solving and peer learning. Although, as the name suggests, it's focused on youth access to health careers. That means the constituency of the group is a little bit different, more so being youth program managers out of our health systems, educators, those that work in general youth development, and very notably, our Youth Advisory Council, which is a small group of 5 students that both advise us on our work and have significant decision making with our projects. In 2026, the Youth Pathways Committee has been lucky enough to really formalize and codify a lot of the priorities that have come out of our quarterly meetings, partner discussions, and the Youth Advisory Council, which the focus in 2026 will largely be research. As the slide says, we'll be researching the geographical, cultural, and social factors that influence a young person's participation in health pathway programs. And so, what we're doing is reviewing literature as far as best practices to conduct outreach, recruitment, and programming for underserved students. And then we'll sort of be validating the concepts from the research in our quarterly meetings with health pathway programs. Um, Additionally, we'll be conducting a literature review in best practices in mentorship and experiential learning, and we'll be soliciting partner feedback to develop actionable recommendations to develop a mentorship framework that we will both pilot at Health and Medicine. Health and Medicine does have direct service youth programming. We have a summer internship where we train high schoolers to be community health workers. And so we're looking to sort of revamp that summer program. But we also want to pilot this and make our lessons learned, our best practices available to regional partners. Um, so some ways that folks can get involved is to participate in the roundtable discussions, can participate in the interviews, and really help me co-develop these frameworks in mentorship and experiential learning. And because this is the CHWC, the employer-led table, of course, we're always looking for employers and other industry partners to look at youth pathways and commit to practice change for a more equitable pathways ecosystem. Next slide, April. Here's a broad overview of the timeline of 2026 and some of the specific data collection tools and agendas for the quarterly meetings. So actually, our Youth Advisory Council has been plugged into a lot of this, and they developed a survey that we proliferated for young people in Chicago to really ask about what their perceptions, motivations, and barriers are for extracurricular and career-focused programming. Additionally, we're analyzing the geographical trends. That's partly in the roundtable discussion, partly through secondary data collection. And then on March 26th, we'll be having a roundtable discussion where we will be inviting program managers that do this health pathway programming to really discuss their outreach, recruitment, and programming so that we can understand the current landscape is and how we can really engage this ecosystem to improve participation for underserved students. In quarter 2, I will be conducting informal informant interviews. That's with subject matter experts in the area, those that have operated mentorship and those that have operated experiential learning. So people that have stood up externship programs, pre-apprenticeship, apprenticeships, things like that. And then in the June 25th Youth Pathways Committee meeting, I'll be presenting the data from those interviews and the youth survey, and I'll be engaging the ecosystem to interpret those findings and really sort of co-develop the strategies for how the mentorship framework and the experiential learning framework that we want to, as I mentioned, integrate into our community health worker summer programming. Moving on in quarter 3, that's when we'll be really finalizing a lot of these best practice toolkits. And then in the September 24th meeting, we'll be presenting our mentorship framework, sort of in a train the trainer model. And so we'll be presenting our best practices in mentorship, and hopefully that will be of some value to um, some of the Youth Pathways Committee members. In year 2, contingent on continued funding, we'll operationalize the mentorship program for health and medicine and for external partners. Awesome. So here is the plug for our next meeting. Our next meeting will be on March 26th. So in just about 2 weeks and 2 days, we'll be meeting at 1 p.m. And this will be an in-person roundtable discussion at Chicago Community Trust, located downtown. So as I mentioned, I'm looking to recruit health pathway programs to attend this roundtable discussion and really just speak honestly and openly about how they conduct their research and recruitment and where they see the opportunities, maybe where they see the gaps, and really how the Youth Pathways Committee and the sector partnership model can be best leveraged to improve our outreach, recruitment, and programming. Additionally, moving forward, as I mentioned, I'll be conducting the interviews in April and May, and then I'll be sharing that interview data and allowing the ecosystem to help me develop recommendations in the June 25th Youth Pathways Committee meeting. I hope to have that in person, location TBD, however. If you'd like to know more, I will plug my email into the chat. Oh, looks like April already got it. So yeah, feel free to reach out and we can confer via email, or I'm always happy to put a meeting on the calendar to talk more about these things. Thanks. Back to you, April.
Thank you, Matt. Very exciting plans for the year. Does anyone have questions for Matt before we move on? All right. I encourage you, get your colleagues involved with that table. If you have anyone doing youth, healthcare, workforce work, um, with that, I will turn it to a debrief of our January 27th event. We hosted a Data Insights for Workforce Strategy collaborative roundtable. This was made possible by the Civic Committee of the Commercial Club of Chicago and their hiring initiative, with a sponsorship, generous sponsorship by the Tolman Family Office and Burning Glass Institute are our subject matter experts here. Um, Before I turn it to Burning Glass, Michaela, are you able to share a
I'm
little bit?
here.
Great.
Can you hear me okay?
Yes.
Thank you. And apologies for being off camera, folks. I am at O'Hare about to board a flight. And for any of you at home wondering, the TSA line was very short and quick. So, but keep your eye on it because travel is increasing with spring break. So, I'm just here to do a quick overview of Hire Chicago, which is the Civic Committee's signature hiring program that we launched officially publicly in January. And this is really an employer focused program to connect employers from across all different industries, but healthcare included, with incredible talent on the south and west sides of Chicago. We have a focus on 20 specific community areas you see here, if you can see the slides. And we are driving toward 20,000 hires over the next 5 years. We're offering a suite of benefits, services, and resources to help employers do this type of hiring. We want to help them with technical assistance if they need it. We want to co-market and brand with them. We've got talent workshops we run each month. We are also offering some candidate sourcing and vetting and introductions to new talent pools if need be. So we can just drive to the next slide. I want to preview some of our incredible partners. Like I mentioned, we don't expect employers to just stand up and do this without ever having done it before. So for those who need it, we are offering services through Corporate Coalition, Cara Plus, and Just Act for things like I said, technical assistance, consulting engagements, and things of that sort. We also have a really incredible set of talent providers that we work with. Many of you know them quite well, and they are doing the training, the sourcing, the vetting, the supporting of candidates. And then, of course, our incredible collaboration partners like April and others across Chicago and the region that are also convening employers. So we really are trying to create this ecosystem of collaborative partners to drive this type of hiring. And then lastly, I just want to preview, we have a set of incredible employers that have already stepped up. Shout out to the team at Rush. Shout out to the team at U Chicago Medicine. We're hoping to have more conversations with hospitals and healthcare systems to help them drive, again, this type of hiring from these communities. To join the program, we ask to work with a specific point of contact on the team to really co-create a plan for success. We are asking them to register to join the program, which is just agreeing to support, agreeing to do this type of hiring, increasing hiring from our talent providers you saw or equivalent pipelines. And then lastly, whenever possible, sharing aggregate data with our team so we can track toward that big goal. So I'm going to wrap up there very quickly so we can get to the really fun stuff, which is the data with the Burning Glass Institute. So thanks, April. And if anyone would like to learn more, please reach out to me. April, I welcome you to share my contact information, and I'm happy to set up one-on-ones with anyone who wants to learn more about our program.
Absolutely. Safe flight to you, Michaela, and I will drop her email in the chat. And now I'm going to turn it over to Cecilia and Joel from Burning Glass Institute to share a little bit of the data that they put together. I will also put in the chat the full deck that they presented in January, which has additional slides. Take it away.
Wonderful. Thank you so much, April, for introducing us. We are, my colleague Joel and I are members of the Burning Glass Institute. We are a data laboratory working at the intersection of workforce and higher education. And I really do invite you to peek through all the slides that April is sharing so that you can get the full picture and experience of the convening that we had. We can move on to the next slide. All right, so we set out with three questions that we really wanted to answer. We wanted to understand which frontline roles are growing and declining in demand, and where retirement risks, could amplify these shortages. I'll voice now that we do not cover the retirement risk slides in this presentation, but if you're curious, check out the deck that April is linking. Second, we wanted to look at the college to career pipeline with a specific focus on the community college pipeline to understand where the gaps are in terms of the stock of potential employees in Chicagoland. And lastly, we wanted to do a little bit of digging to understand how people move within these roles. So which jobs show the highest rates of worker departures and where are they going? And so we'll do a deep dive on medical assistants and certified nursing assistants pathways towards the end of this presentation. Thank you, April. All right, so where is demand growing in the Chicago area? On the right-hand side, you can see a view of this. I'll say this is underpinned by job postings data. And one key thing when looking at job postings is that it is not always the case that a single job posting corresponds to one position. Sometimes there is a job posting, there might be 4 or 5 vacancies associated with them. And I want you to keep that in mind, especially as we click through some of the next slides. When we look at the mix of occupations that are growing here, up the top of the chart, we see speech language pathologists, occupational therapists, and then we go into radiologic, technologists and technicians, and nurse practitioners. So these are some of the top growing roles in Chicago where we've seen job postings spike up over the last 5 years. Now, what does the supply of people that could fill those roles look like? So we went ahead and looked at the community college graduate supply and for the region. And when I say the region, I mean a very expansive view of Illinois, Indiana, and Wisconsin. We do this by looking at folks that are graduating from programs that are typically pathways towards roles in healthcare. And that's how we map this out. So what you see over the last 5 years is a relatively stable decline. All told, from 2010 to 2024, we're seeing about a 13% decline in the number of graduates that are part of the potential supply for healthcare occupations in Chicago. To the next slide. All right, now here, this one is one where I really want you to be mindful of what I shared earlier, that not every single job posting corresponds to a vacancy one-to-one. So here we're looking at where is there high grad supply and low employer demand on the left-hand side. On the right-hand side, we see tighter relationships, right? More like a one-to-one or topping off at like 1 to 1.5, where we see low graduate supply and high employer demand. Some of these are very stark. I will direct your eyes to registered nurses, which is second from the bottom on the right-hand side. And you can see there that it's quite a chasm between the estimated community college graduates and estimated job openings in Chicago. This is not necessarily unique to the Chicago region. Registered nurses, are in short supply nationally. And what is more, it's an occupation that people churn out a lot of. So the need is also aggravated by that amount of churn. On the low grad, low supply, we also see radiologic technologists and technicians, which we noted is one of the top growing occupations in the Chicago area. Medical assistants are also quite tight. And again, though we present here a share of graduates to openings, know that this is not necessarily a one-to-one matchup. And so when I look at these two tables, I like to think about how can we create pathways for some of the oversupplied occupations on the left to fill into the undersupplied occupations on the right. And that's kind of how we think about these things. And we can go on to the next slide. All right, so beyond the aggregate view of the decline in community college grads, we wanted to, do a little bit of a tighter analysis and look at where are graduates declining relative to specific positions. And so you can see the list on the right-hand side to note where we've seen dips in number of graduates. I'll once again, bring up the magnetic resonance imaging technologists and technologists and technicians in general. We've seen a bit of a dip following 2020, although it's been fairly stable. And I believe next slide, I am going to invite my colleague Joel to walk you all through what do pathways look like? How do people experience these roles? How long do they stay? Where do they go up next? And so Joel, I'll let you take it away from here.
Right on. Thank you, Ceci. So good morning, everybody. My name is Joel, and I'm also with the Burning Glass Institute. And so the next bit that we're going to look at is tenure, right? So once folks make it through their programs and into those roles, how long do they stay, right? And so this is critical for certainly patient care and high functioning hospital and healthcare systems, and for the benefit of the folks that are in those roles. And so we've highlighted a couple of occupations here that really jump out at us. So CNAs, certified nursing assistants, and medical assistants. So you can see here when we look at the typical tenure that CNAs have in those jobs, it's less than a year and a half. Right now, these are the observations that we have. We can interpret them in any number of ways, and whether somebody stays in a role for a long time could be a function of being stuck, or it could be a function of them being stable, right? But so what we're looking at here is just sort of the tenure on its face. Medical assistants stay a little bit longer, 2 years, but in the grand scheme of things, that's a fairly short tenure. And as you look across these occupations, across these roles that we've flagged here, probably doesn't surprise most folks that the tenure increases when folks sort of training and specialization increase, right? So easy in, easier out. When it's a higher barrier to entry, there's, I think, an impetus to stick around a little bit longer. So I think it's fair to ask, so how do we like these numbers, right? When we look at the year, 1.42, just under a year and a half for CNAs, or 2 years for medical assistants. Is this a function of just how difficult those jobs are, right? So the hours are tough and the work is intense and all of that. And of course, we can't ignore pay, right? So the lower barrier to entry occupations are going to have sort of a lower wage. So we have to ask ourselves, hey, what part of that equation do we want to try and influence? Do we want to encourage folks to stick around? Do we want to encourage the employers to make it more worth their while to stick around and so forth, right? So as we look at these sort of tenures and think about the implications for those workers themselves and for the systems where they work. So we'll go on to the next slide. Thank you. So now what we're looking at is departure rates at the 5-year mark. So before we were just looking at, hey, what is the average tenure? But for those folks that make it past that 1.42 year mark or past that 2.0 year mark, right? Let's look forward to that 5-year rate. And we're looking now at the roles that continue to experience high departure rates at 5 years. And then on the right in the blue are those roles that experience lower departure rates. And so CNAs, are still on that list, right? So roughly 75% of CNAs leave those jobs within that 5-year period. So that's a pretty substantial churn that we're looking at. And then similarly on the lower departure rates, again, we're looking at some of the higher skill, higher barrier to entry, higher wage occupations, across that range. So we can ask ourselves, okay, so when they leave, what happens, right? Where do they go? So what we're looking at now is just that very question. What is the next job that someone has when they leave either that CNA role or that medical assistant role? So when you look at that CNA role, we're seeing some pretty good advancement, right? So 40% of the folks' next job is a registered nurse role. So of course that assumes that they have taken on some additional education and training and credentialing, during that time period, which is great, right? We want to encourage them to continue learning and to continue to be able to achieve those higher wage occupations. So that's a, sort of a good advancement. And so for my money, if somebody's going to leave a role, better that they leave it in service of higher levels of care within healthcare organizations and better wages for themselves. That certainly registered nurses are going to experience better wages than the CNAs. It's a slightly different story when we look at those medical assistants, right? 2 years off, when they change jobs, there's a better than average chance that they're going to be moving into just another medical assistant role. So we're looking at a job change, but not an occupational change, right? And so a medical assistant is more likely to stay within that band of wage and so forth when they make that move. So why CNAs are availing themselves of education and training and advancement opportunities to a far greater degree than the medical assistants are is certainly worth looking at. And so for those of you who are preparing each of those types of workers for those roles, to be thinking about longer term advancement and whether those medical assistants can be supported in a way that allows them to achieve the same kind of or similar kind of advancement than the CNAs do. And that I believe is my time on this one.
Thank you so much, Ceci and Joel. We have time for one, maybe two questions if anyone wants to raise their hand. We chose to present some of the slides that generated the most conversation at our event in January. I know the slides pertaining to community college graduates versus the demand. We had many of our great colleagues there from city colleges who referenced that there are a lot of programs where we have waiting lists of students, and we can't grow these programs because we don't have enough clinical slots. That's a common challenge that has come out of our respiratory therapy work. We know that exists in nursing. Do we have a question here from Matt?
It's not a question, but it's a good observation, right? That there are some folks who embark on their career, they reach that CNA status, and then they build on that to become an RN. There's other folks whose goal all along has been RN, right? And so they will, while they're in school, they'll pick up that CNA and do work, but really their main gig, so to speak, is pursuit of that RN. I think that's a great point, Matt. Thank you for raising that.
And Bridget, you are asking, are all of the roles that we've highlighted here high need? I think that each slide is a different data set. There's some that display where there's maybe less employer demand. Did you want to clarify the question?
So on this particular slide, we're not qualifying for need, right? We're just looking at the roles within healthcare and ranking them according to those next steps. So we're not making a judgment that a nurse midwife is more or less in need than a physician assistant.
Okay, well, thank you so much, Ceci and Joel, for putting together this analysis for us. There are more slides than what we just shared today, so I encourage everyone to check out the full deck. If there are questions lingering, feel free to email me and I can see if we can explore some of those questions. I also will continue to provide data reports in our newsletters on about a quarterly basis. So we want to, continue to bring data into these conversations as much as possible. And huge thanks to the Civic Committee and to the Tolman Family Office for making this possible. Thank you, Joel and Ceci. Feel free to stick around if you'd like. Okay, packed agenda today, as always. So now I'm going to stop sharing my screen and introduce Jordan Powell from Illinois Health and Hospital Association to provide a workforce policy update on the state level.
Yeah, thanks, April, and good morning, everyone. Can you see my screen okay, April?
Yes.
All right, great. Well, it's a pleasure being here this morning, and I appreciate April inviting me here. For those of you that aren't familiar, IHA is an organization that represents almost every single hospital in the state of Illinois. And I'd say the number one service that we offer is advocacy and policy. So I want to give a policy update on workforce and some things that have been happening here in Springfield, where I'm located, over the last few years, and then I'm happy to answer any questions. So first, I want to begin with legislation that was an initiative of IHA last year that creates a healthcare workforce task force act. This legislation was passed last year by the General Assembly. It was signed by the governor in August, and it went into effect January 1, so just a few months ago. And really, the impetus of this was when we ask our members, what are their top challenges? Every single year at the top of the list, it's workforce. And we just heard of some of the challenges from the previous presenters. So we noticed at the legislative level that the legislature, in terms of addressing workforce challenges, kind of had a piecemeal approach where they wanted to handle different issues in different buckets. And we thought, look, all of these issues are interconnected, right? Recruitment and retention is connected to workplace violence, right? And recruitment is also connected to medical liability in the environment here that we have in Illinois. So how can we approach this more holistically, right? And really drill down into what policies can be developed to address these challenges. So we're going to take a deep dive into issues that I have listed here: recruitment and retention, the state licensure process, which we continue to hear is a challenge. And I'm going to provide a brief update on that. Pipeline and training programs. I already mentioned workplace violence, promoting access to healthcare careers, and as I said, the medical liability environment on workforce. And the purpose of, or what the outcome of this task force is going to be, a report that is sent to the General Assembly with recommendations on how to address workforce challenges facing various healthcare providers. And then we hope that those recommendations are seriously considered by the state legislature. So once the task force is appointed, the governor is in the process of making those appointments now. I think we're only waiting on 2 more appointments. And so we expect these meetings to begin next month in April. By April 2027, they have to develop a report. So they have 1 year. So there is a possibility that we may be able to get legislation passed next year that includes some of these recommendations. I did just want to share briefly the composition of the task force. So we have various state agencies and legislators, but what I wanted you to see is, the different voices that are going to be at the table. Okay, it's not just hospitals. It's going to be physicians, nurses. For allied health professionals, we're going to have a CEO of a community mental health center. So we're going to have the behavioral health perspective, nursing homes, FQHCs, emergency docs, nursing schools, and of course, organized labor is going to also have a seat at the table. So I hope to come back to this group at some point and report out that this task force was very successful. It developed some really strong recommendations, and then IHA and other advocacy groups were able to pass legislation or pass certain policies or rules that will improve the workforce in the state of Illinois. So more to come on this. Next, I want to provide an update on the licensure process at the Illinois Department of Financial and Professional Regulation. I'm not sure how many have heard of these challenges, but essentially, there's been a paper application when you want a physician, when you're recruiting a physician or a nurse, and they have to fill out this paper application and they have to submit it to DFPR to get licensed, and it could get lost, or there's a backlog, or a number of challenges that there would be significant delays in the licensure process where you might lose a physician, you might lose a nurse, you might lose another profession that requires licensure. So we worked with the legislature and with other groups to provide DFPR with funding to procure an online licensing system, right? And what we're told is with this new licensing system, what would typically take weeks or months in terms of getting licensed, it will take a matter of days, right? So this has been a process that has been 2 years in the making. For those of you that are familiar with state government, things don't happen quickly. They take time. So this has been 2 years in the making, but there have been professions that have now been uploaded onto the online system. They are kind of fixing some of the various issues with the licensing system before they put all the healthcare professions online. But it's our understanding that DFPR aims to have this fully implemented by this summer. If you were to ask me realistically, I'd say it's more the fall and maybe fingers crossed by the end of the year. Again, the state, it's just different, right? There could be another delay, but we continue to press the governor's office and DFPR to get this finalized as soon as possible. And it's something that's very important to our members. And then I want to provide just one final update on something we are excited to partner on with legislators to recruit international medical graduates, and so that they could have a pathway to become fully licensed in the state of Illinois. So this is legislation that passed a few years ago. We worked with the Department of Financial and Professional Regulation on rules, and now it is law, and now it's been implemented. So if you are a foreign trained physician, you can apply for a limited license here in the state of Illinois now. Part of this limited license, which is going to be a length of 2 years, you must have a sponsoring entity. So it must be a hospital or an FQHC or a multi-specialty physician office. And then you have to practice under the supervision of a physician in the same specialty. So then after those 2 years, you would then move on to a restricted license. So then you can practice independently, but you must practice independently in an underserved area. And off the top of my head, I forget how that's defined, but it's defined within the law. So they're not permitted to have a solo practice at this time or telemedicine services, but they can practice independently. And then step 3 is full licensure. Once they receive full licensure, it's like any other physician in the state of Illinois. So it's a 4-year process. There is a pathway for these individuals, and we are excited to partner on this effort. Now, there are a million other things going on, and I'm pointing out here because the State House is right here outside my window, but I know I have limited time. But these are the top updates, I think, for this group that you should be aware of as it pertains to workforce. So with that, I think I saw maybe some questions in the chat or comments, and I will take a look at those now. Will any additional policy be added to this? So will any additional organizations be added to this task force? Great question, Tara. The answer is no. So this is outlined actually in statute, but what we can do, if there are other groups that are interested in participating, we can invite them in to one of the meetings and they can give a presentation. So, while community colleges aren't listed as a voice around the table, they can be invited in and they can speak to the group and make their pitch. Thanks for your comment, Bridget.
Yes,
Thanks,
as far as
Tamar.
if women employed, they do a fantastic policy work. So I'd encourage
Okay.
that connection. And Tamar, I definitely wanted to shout out Tamar and the work of Upwardly Global in bringing that international medical graduate work to fruition. They have been working on it for years. Tamar supports international medical graduates on navigating these pathways. I'm really excited to see this finally come to fruition. Tamar, I don't want to put you on the spot, but if you want to share anything additional, feel free. Oh, but we can't hear you.
Hi,
Oh,
is
there
this
you are.
better?
Yes.
I forgot I wasn't talking. Um, Thanks so much, Jordan. So excited. Last week we got our first license issued. I will put a link to our press release in the chat. We're super excited, and I'm especially interested. I know the recruiters and employers on the call today aren't necessarily hiring doctors, but if you want to talk more, I put my email in the chat. It's been really exciting, and so appreciative of the support of the state. Once they got engaged, they came into it fully engaged, and it's been a really interesting. The task force meetings are open, so I'll also put a link to the task force page if you want to attend. And yeah, so excited about this effort.
April, thanks for shouting out Upwardly Global. And I remember the very first meeting that we had with Upwardly Global and Representative Teresa Ma. So thank you, Tamar, for all your efforts. And this is a great outcome.
So happy, excited to continue to collaborate and see more doctors working in Illinois.
Very exciting. And yes, thank you, Jordan, for coming and presenting these updates. I know we'll all be very curious to hear what comes out of the workforce task force. So I'll certainly be following up with Jordan and inviting him to share again. Any questions for Jordan or for Tamar as well about the IMG? Okay. And we're just throwing lots of information at you today.
Well, thank you all. Thanks for all you do. And I look forward to coming back to this group and giving an update on the task force.
Yes. Thank you so much, Jordan, for coming. Feel free to stay on or hop off, and we'll certainly be in touch. And with that, I'm going to pass it over to Zhao Fan from OAI to talk about the Registered Nurse Apprenticeship. You should be able to share your screen. Cool.
All right, thank you, April. Let me see whether I can share the screen. Can everybody see my screen?
It's coming up right now. There it is.
Okay, sounds fantastic. Good morning. My name is Xiaofan Liu. I'm the Chief Operating Officer from OAI INC. Today we're going to cover our DOL-approved Registered Nurses Apprenticeship Program. And our program manager, Yvette Bell, is here with me. She's going to start this conversation, and she's also the manager, over all the registered apprenticeship programs at OAI. Okay, Yvette.
All righty, next slide. A little bit about who we are. OAI is headquartered in Chicago, Illinois, and founded in 1978. Our mission is to provide skills training that leads to safe, meaningful employment while helping companies and communities to thrive. And to accomplish this, we've developed and implemented programs that help individuals access educational and employment opportunities, leading to economic self-sufficiency and a chance to reach their career potential and build a good life. Next slide. So we're actually OAI funds training and provides supportive and barrier reduction services to underserved populations in the Chicagoland. The funders related to the apprenticeship programs are Illinois Department of Commerce and Economic Opportunity, Blue Cross and Blue Shield, Bank of America, Polk Foundation, Local Initiative Support Corporation, which is LISC, and Chicago Cook Workforce Partnership. So, the the Registered Nurse Program. These are some of the highlights. So the Department of Registered Apprenticeship, they have a 2-year competency-based program. There's a $3,000 tuition support, which is provided by OAI, $800 in supportive services. Sorry, something came up. Supportive services for the apprentices, and then OAI provides recruitment and participant support. And we also have a structured pathway, some keep popping up, to registered nurses licensures. So we're asking that you partner with us to develop the next generation of nurses. So these are the benefits to the employers: new hires or incumbent workers, well-trained certified RNs or RNs to be, motivated, supported by OAI, potential for OJT funding, and OAI is the apprenticeship creator. Is the apprenticeship creator or sponsor with minimal paperwork for the employers.
Okay, thank you, Yvette. I think I'm taking it over from here, right?
Yes.
Yeah, just a little bit on the new hires or incumbent workers, in case anybody has any questions. So this is apprenticeship program. So eventually we cannot enroll anybody without the employer. That's why today we're more like recruiting employers rather than recruiting participants. They can start from any positions, not necessarily starting from certified nursing assistant, but that is the position that we see a lot more than the other positions to start the registered nurse apprenticeship programs. I think everybody heard Joel's presentation earlier. You know, nursing assistants show upward transitions. I think this is one of the upward transition pathways. And for the employers, those are the benefits Yvette just covered. And for employees, what we are able to provide is about 3,000 tuition support from our apprenticeship competitive grant, which is funded by Illinois DCO, where they got the funding through the Department of Labor. So it's a federal pass-through, but we receive it at the state level. I think that's a little bit more stable than receiving it directly from the federal at this point. And also we are able to provide $800 in support service. That's, transportation, books, supplies, exam fees, anything we might need during the entire training phase. And OAI does have financial coaches and career coaches if any of the participants would need those services. And it's a structured pathway to RN licensure and career development. And we'll provide retention support if anybody complete their training, stay at their position, and they have additional needs. We always provide 12 months follow-up services after they complete their training. So what does it mean for OAI to be the sponsor? So that means we've already done all the DOL level apprenticeship registration paperwork. You don't have to do any of those, and OAI will be responsible to manage all the paperwork and reports submitted at DOL level, and will manage the RAPIDS database. So pretty much as an employer, you will choose your customized parameters for your apprentices. We will need what are the performance benchmark for the apprentices or the incumbent workers you would like to upskilling. We want to know what's their current pay rate and what's their hours per week. They will have to work a full-time schedule in order to be able to participate in a apprenticeship program. If they are a part-time worker, let's say working 20 hours per week, that wouldn't work. And shouldn't say only, but the main two responsibilities for employers in this program is that you'll provide, of course, supervision and mentorship for any apprentices in this program. And periodic reviews is required. Our program is competency-based model, so it's a 2-year program. That means they will be considered completed if they meet the performance benchmark, and which is the competency levels set up by the employers. And I think most employers, if you already do annual performance review, that totally works with the timeline. And if you already have a wage schedule associated with those annual reviews, yeah, that works too. That's the graduated pay schedule if the employee meets the benchmark. So you will meet those requirements of the apprenticeship program. For OAI, we will need those review results with us. We will need to know whether they receive a pay or if they quit their job or if you let them go. Those are things we need to know. Those are just some basic questions that we think people might want to know, but if you have a different questions, I think this is time that you can totally ask us. Again, this is a competency program. The estimated time will be like 2 years. That means within 2 years, we're expecting a participant complete the entire RM program, receive their licensure, and meet whatever the performance benchmark you set up as an employer. And there's a probation period. However, if you are upskilling your incumbent workers, I don't think that applies because they will probably already pass the probation period. We do have a little bit additional OJT funding possible, but there's nothing I can guarantee at this time. So it's more like a case-by-case funding because OAI doesn't have OJT funding. It will be supported by our partner. And yeah, if you're interested, if you want to talk more, you can contact Yvette or I for the next step. What we need will be a employer participation form that lists your basic information. And we want to know what's your performance benchmark, when you would like to, what's the frequency of performance evaluation, and if your apprentices meet those benchmarks, what's the wage schedule look like? I think that's everything from OAI side. Is there any questions for us?
This is super exciting. I'm so excited that we have a registered nurse apprenticeship in our region now. I was asking Xiaofan some questions before, and my understanding is that one of the priority groups is your incumbent workers, your existing workforce at hospitals. So if you are, hoping to create a nursing pathway for your nursing assistants or your medical assistants or other frontline staff, I think this is a great opportunity to partner and have some of that funding covered. And Michelle, thanks for chiming in. Michelle is with our Healthcare Sector Center, and put in the chat that that center can also support eligible employers with that federal funding source, that on-the-job training source, reimbursement for up to, is that $10, Michelle?
Oh, sorry, it's 10K, 10,000.
Okay, I figured that.
Certainly makes a difference. 10,000.
And is there a way for job seekers to apply to this? Xiaofan.
For job seekers, so we are still in the process of recruiting employers because we have a total of 25 slots and the grant will cover till June 2028. So we want to make sure we have employers secured first, and we will do estimates on how many incumbent workers versus how many new recruitment. We'll probably open that participant recruitment in the summer. However, it's a RM program, so there are some prerequisites. It's not open to anybody who would like to get into the nursing career pathway. If they don't have those prerequisites ready, they are not gonna get enrolled in any nursing schools. So far, our training providers are Prairie State College and King Academy, so they are more on the south side. But we're open to work with any other training providers who are, eligible in the state of Illinois to provide the RN training. The training we put in the apprenticeship is the pretty standard RN training. So as long as it meets all the requirements, yeah, we can work with other training providers in the city if that works better for the employer and job seekers. Yvette, anything else you want to add to this question?
I think you covered it.
All right.
And Jay from Ascension was asking about those training providers. I believe it's Prairie State Community College. And then was there a second one that you're already working with?
Yeah, the second one is Khan Academy. They are a private training. They're a private nursing school, I think in Madison, so they are still like South Suburban Cook.
Good to know. So employer partnerships is what you're looking for first and foremost, and then conversations about who the training providers could be, what sort of recruitment methods for the individuals going through the program. My understanding, correct me if I'm wrong, is you can, sort of customize that with the employer.
Yes, that is correct. Yep.
I do have one question, and I feel free, anyone, if you have a question, feel free to raise your hand or throw it in the chat. Is that you mentioned that they have to be full-time employees, not part-time. Is that coming from the DOL requirements or?
Yeah, I think in our template, let's say they will be like a full-time employee. By full-time, that means like 30 hours per week, not necessarily like 40, but yeah, they have to have a minimum of 30.
And they would be going to nursing school full-time.
Oh, that will be a conversation between the employers and how the setup at nursing schools. So we're working with some hospital at this time, and I think their incumbent workers are just maybe taking some class in the daytime, then they take the second shift, or if they are working the first shift or second shift, they would just do some classes in the evening or weekends.
Got it. Got it. And Jacob added a question to the chat. Jacob's with Endeavor Health, which is in the, north suburbs primarily, north side of the city as well. Can you confirm what kind of geographic area OAI covers or is covering in this grant?
So Yvette and I works more on the south side office, but for this grant, it opens to any employer who's based in the state of Illinois and any resident who live in the state of Illinois. That's the, minimum requirement from the grant. For OEI side, yeah, we'll probably just cover the entire Chicagoland area if it's, if they're in, I want to say Kankakee or maybe a little bit Lake County, if they're a little bit far away, if we see there's a strong need, we'll figure out if there's anything we can do, but mostly it's the Chicagoland area.
Great. Awesome. Jacob wants to connect.
Oh, sounds fantastic. Well, our email and phone numbers are just on the screen.
Any other questions for Jeffan and Yvette? Okay, well, kudos to you all on having the first, Department of Labor registered apprenticeship for registered nursing in the area. I'm hoping that this is just, the pilot of what becomes a more adopted model for our nursing pathways here in the region. Now I know that we're having a marathon of presentations today, but we're actually running ahead of schedule. And we're about to have our last one before I open the floor for community announcements. I will share one slide here. Anna Yankolev, who is the facilitator of our sister table, the Public Health Workforce Collaborative, and I cannot even see my own screen. Am I sharing the slide?
You are, April.
Great. I will pass it off to you to talk about the Career Pathways resource.
Thanks so much, April. It's great to be here with you all this morning. As April said, my name is Anna Yankolev. I facilitate the Public Health Workforce Collaborative, which is CHWC sister table. And together with our Youth Pathways Committee table, our three sisters, we, a couple of years ago, identified kind of a shared challenge that we all had around helping people get started and navigate career pathways. Because when a lot of people think, oh, you want to work in healthcare, you think doctor or nurse. You don't think about respiratory therapies or speech pathologists or imaging techs. So we, Health and Medicine, embarked on this journey to try to catalog and demystify these career pathways in health in a way that makes it really accessible and understandable for job seekers, both new to the field and wanting to expand their careers in the field. So we created it's going to be a book. The final version will probably be about 300 pages, but it has a ton of information in it, including a section on why, how health affects people's lives in different way, and how it's not just what happens within the four walls of your doctor's office, but it's in your communities, it's in your local community gardens, it's in housing safety, it's in making sure that our food systems are healthy and free from parasites and other infections. We also have a directory of over 130 different careers, so more than just doctor and nurse for sure, but lots of different jobs that include information on salaries, job outlooks, whether or not that position is expected to grow or shrink over time, a brief explanation of what the job actually does, the kinds of education or professional requirements that you need for each job, and the types of skills or interests someone might have to be entering that profession. We also include a career pathway guide, which has examples of different career paths that you could take. These are for inspiration and not prescription. And the feedback that we got from our community partners and job seekers was that they wanted stories of people from their neighborhoods that looked like them, that started where they started, on how they got to where they are. So we've got worker profiles built into the printed resource, and we will link those to video interviews. They're really powerful and inspirational stories of how people have navigated their career journeys, and those will be available as well. And many of you have support resources that you made us aware of, whether that was support for writing a resume or job placement or something else. So we've included all of those as well. So I'm excited to share with you today the mini version, and April will send this out when she sends out her notes. April, can I steal the share? Oopsies, let me in.
Okay, gave you.
There we go.
Okay.
So because this is such a long resource, we realized that it might be a little bit overwhelming for people to just open a 300-page PDF. So we created this sample or mini version that just has some of the key takeaways. And this is something that if you're doing a job fair or just want, something to hand out, this is a lovely little resource that will print to be, to be about 8 pages front and back. So it's a little bit more digestible of a document to share out. But this is just a preview on what the full resource will look like. So it's called Your Career in Health. This is the sample guide, but it will be a full guide to getting started, growing, and thriving in the health workforce. We've got a bit of a guide and some table of contents and what's in here. I've just talked through all of this before, but just some orientation. And then it jumps into why work in health. So this talks about all the different ways that health impacts, or that different factors impact how long we live, how well we live, and how often we get sick, as well as, I'll zoom in a little bit here, you can see some of the different jobs that impact people's health. So we really take a broad look at what health looks like, and include all sorts of different options in the field. Here's an example of what the directory will look like. So you can see we've featured our occupational and physical therapy jobs for our sample here. So they have salary information, outlook, a brief description, educational and training requirements, and skills and interests. So just a high level overview of what the positions are. And we have these pathways. So we map these out with help from websites like Lightcast and with key informant interviews with folks from the field to identify how to move from position to position. So you can see we've got a key here of all the different educational professional requirements that are needed. But it kind of maps out, we're on our RL here, where you can go to get to where you want to be so that folks can actually see the trajectory of how they can advance in the field. And the full version features 18 different pathways. So we've got respiratory therapy, physical and occupational health, imaging, which includes MRIs and X-ray techs, nursing, emergency response, oral health, community health, mental health, social work, environmental health and occupational safety, nutrition, public health, urban agriculture. And then we've got a couple of pathways that don't really have linear progressions like some of these other pathways do. So if folks are interested in things in governmental public health, nonprofit public health, holistic health, so that includes things like acupuncturists and other holistic healers, and reproductive health, so our doulas, midwives, and lactation counselors as well. Then, of course, there are our career journey examples from real Chicago residents of how they've navigated their journeys, some advice that they've had. This will, in the full version, link to the video interviews on our website. And then we have laid out in detail the steps you need to take to get to where you want to go. So you're starting with a high school diploma or GED. These are the two things that you need to do to become a physical therapy aide. Here's some information on a physical therapy aide. The next step in your journey is a physical therapy assistant. You can do 2-year full-time or an accelerated program in 1.5 years to get to where you want to go. So we really lay out in detail what the steps are to get to where you want to go and what the benefits are for advancing along in your career. So again, as you can imagine, there are about as many journeys as there are people in the city. So we've chosen a couple of more common pathways, but this is certainly not encompassing every pathway that you can take, but really just to offer some inspiration and examples for job seekers on what they can do to get to where they want to go. So yeah, there's a ton of information in this. We're so excited to get it out into our community. Hopefully in the next couple of weeks, we will have that full version and we'll be sure to share it with all of you. But this is something that if you're working, whether it's young people, whether it's non-traditional students, or just someone that is looking to figure out what their next career step is, this is something that you can give them. It's going to be really accessible as far as, how to navigate across the resource. And yeah, I'm happy to take any questions, but we're hopeful that this will help inspire some new conversations and entries and advancement in our health sector as folks learn to grow and thrive in the health workforce.
Our hearts are just exploding on so exciting that this is finally becoming complete. I know there's a lot of work put into this. It's very exciting. So there is the mini version available right now, Anna, right?
Correct.
Would you mind putting the link to that in the chat?
We don't have. I will send you a PDF copy that you
Got
can
it.
include in the
Okay.
follow-up.
So I will.
Yeah,
I'll include that actual PDF in an email to everyone who registered for today. I will send that email out probably tomorrow, definitely by Thursday, with the recording of the meeting, the full slide deck, that PDF. And then, I'm sorry, I'll repeat the timeline for the full guide.
The next couple of weeks.
Got it.
We've got to straighten a couple of things out, edit it, make sure it's ready for the public. We do have our website. It will be I'll drop the link in the chat. Right now it just says, more information coming soon, but that'll be the landing page for the full resource, the mini resource, and all the video interviews in the coming time. So you can always check back there to access the resource at any time.
Awesome. And I will be certain to share the mini resource and then the full resource once it's available through CHWC's newsletter. Also happy to link it on our resource page on our website. And great question, Christy, in the chat about, that we've had so many content-rich resources we've talked about in this call, and how do we connect job seekers? I think in every way that we can, that is what we're here for. I know that Matt has opportunities that job seekers can actually engage with, like surveys. This resource is for job seekers. Anna, are there more ways that we should be thinking about helping to get this particular guide out in front of people, or that we all can support that?
I think I'm seeing a lot of great like career fairs that we're doing, or organizations that work with specific types of students. Really, this is something that we want out in the community. So you can print out the mini version. You can include the link to the thicker version, the book. If you've got funding to print the book and bind it, we would be happy to do that for you. We just don't have any funding ourselves for that. But really, this is meant to be for our community. So whatever community you're working with, please share it with them. We want it spread far and wide. And yeah, we'll go from there.
And I know CHWC, as well as the Public Health Workforce Collaborative, are committed to making sure that, all that work gets in front of job seekers and students. So we're here to support throughout this year. If any of you have ideas on how our collaborative tables can help support the proliferation of this resource, feel free to reach out.
April, can I ask a quick question? Just because I'm relatively new to this group, and so the full membership is not as clear to me. Do we have organizations on the job seeker side who sit at this table? I just wonder, I'm just thinking about sort of the most expedient ways to build that bridge. And I don't know, it just feels, maybe the answer is a resounding yes, but if it's not, I wonder if that's an opportunity.
Well, I know we have representatives from our community college and Chicago public schools. I know there are organizations here who are engaged with young people, with students in healthcare career exploration. But there's so many more out there. So I hope we all help get the word out.
Yeah. And if anybody has any recommendations, I know that we've got lots of connections at Matt's table with Boys and Girls Club and, city colleges and a lot of the more conventional places. But if there's, community-based organizations or churches or wherever, libraries, we've talked with Chicago Public Libraries, park districts to get this out. We are more than open to it.
Tara.
I should know this answer, Anna. But is it going to be a Spanish version released also?
We would love to have a Spanish version if we can procure funding for it. So any funders on the call that want to support translation of this into a different language, we welcome that.
Awesome.
And before I cede the microphone back to you, April, I'll just put a plug in. As I mentioned, I facilitate our sister table, the Public Health Workforce Collaborative. So that table has lots of representatives from our FQHCs, from our behavioral health centers, our reproductive health tables, our community health tables. So if your organization supports workers in those domains and want to be a part of the conversation, our quarterly meeting is this Thursday from 1 to 2:30, and we would love to have you there. Excuse me, I'll drop my email in the chat if you have any questions about that or the Career Pathways resource or anything else public health related. Happy to chat.
Thank you, Anna. And with that, I will open the floor for any community announcements. If anyone else would like to share something. I did not make a slide for this, but I want to quickly congratulate the partners in Health Catalyst who have won the Pritzker-Traubert Chicago Talent Challenge that was announced recently. Kudos to all of our friends here from Cook County Health and City Colleges of Chicago on this really exciting project. CHWC is here to support you in any way. I know I'll be connecting with you all about how we can support. I also noticed that Pritzker-Traubert included an ideas bank on the website of some of the other great ideas that were finalists that didn't get funding, but could come to fruition if they got funding. Anyone else have announcements to share? Oh, and Brandon, thanks for putting those in the chat. These are great resources.
Question, will we get a copy of everything that's been presented today?
Yes, I will send everyone who's registered the recording, the slides, the PDF of the mini version of this Career Pathways resource that Anna just spoke about. There might be a couple of other things that
And some of those
if I can
clicks
get.
some of those clicks that were in the chat, we'll get that as well.
Yes, definitely.
Sorry for that question if it's redundant.
Oh no, thank you, Leslie, for asking, because it makes sure that I grab everything from the chat. I will. Yes, there's been so many resources today.
Yes. All right. You have a great rest of the day, everyone. As you as well.
You too, Leslie. Good to see you.
It's good to be seen.
Anything else anyone wants to share? With that, I'll leave you to digest everything that we just went over. I look forward to seeing everyone in person in June and September for some more opportunity to discuss and collaborate with each other. Again, June is June 2nd at Malcolm X College at 9 a.m. to 10:30 a.m. And we will be focusing on federal policy and funding changes. So very rich conversation that will be. Everyone have a great day. Thanks for coming. Appreciate you all.
Hey, April, can you hang on?
Oh, sure.
Thank you.
It
Have
took
a
me a
great day.
while.
Thanks all. I'm just going to stop recording.